You think your dog hates the car because they're stubborn, but that's not the full story. Most dogs don't refuse the car out of spite. They're responding to a chain of tiny signals, smells, sounds, motion, past events, and your reactions have written the script. That refusal is a language. It's telling you something about safety, predictability, and trust. Listen, there are 3 core reasons dogs avoid cars: sensory overload, learned negative associations, and control anxiety. And each one demands a different answer. First, sensory overload. Cars are a sensory storm. Moving scenery, echoing noises, shifting smells, the odd motion of acceleration and braking. For a dog whose world is driven by scent and balance, that can be chaotic. Vestibular discomfort, their inner ear feeling off, and motion sickness is real. What looks like sulking is often nausea or vertigo. When a dog climbs in once, gets sick, and associates the car with that sick feeling, avoidance becomes logical. They're protecting themselves. Second, learned negative associations. Maybe the last times the car appeared, it meant the vet, a bath, or an unfamiliar place full of stress. Dogs don't generalize like humans. They form tight associations. 1 or 2 bad trips can tattoo the car as predictable bad. When you rush and grab the leash with anxious energy, you're reinforcing that negative forecast. Your body language becomes a cue. The car equals stress. Their refusal is a reasonable attempt to escape a remembered outcome. Third, control anxiety. Dogs are social animals who prefer predictable rules. If you force them physically into the vehicle, you remove their agency. That loss of control can amplify fear. They escalate from polite avoidance to full-on freeze or even panic because the situation is uncontrollable. In their mind, the car is powerlessness made concrete. Now pause. Context changes everything. If your dog balks in the driveway but hops in for a drive to the park, the barrier is expectation. If they refuse completely, look for trauma, pain, or sensory issues. Every 20 to 30 seconds, there's a new clue to check. Where does the refusal happen? Before the door? At the ramp? Mid-step? Each point maps to a different diagnosis. So how do you turn refusal into calm confidence? Use a 3-part plan: desensitize, reframe, and empower. Desensitize slowly. Start by making the car part of the daily environment rather than a one-off event. Park with the engine off. Toss treats inside. Let your dog sniff the open door at their pace. Repeat short, non-driving sessions that end before the dog shows stress. The idea is to rebuild safe, neutral memories. Keep sessions short, 2 to 5 minutes, and end on a positive note. Progress should be measured in tiny wins. Reframe the car as a source of good outcomes. Pair the car with things your dog already loves: a favorite toy, a short walk, a meal. Don't always follow car access with the vet. If the car only ever equals headaches, it will stay a hazard. Use variable rewards. Sometimes a long walk follows, sometimes a quiet sniffing break, sometimes a visit with a friend. Unpredictability of positive outcomes breaks the learned negative script. Empower your dog with choice. Teach simple behaviors like target to a mat or ramp and reward a voluntary step into the vehicle. Use a release cue so they understand they are choosing to enter. Avoid forcing. If your dog is physically reluctant, use a harness and low ramp to reduce pain and avoid lifting, which can heighten fear. Control returns when you let them decide the pace. Midway, if this is changing how you see your dog, hit like and subscribe. Small shifts here save stress on every trip. Now, layer in behavioral and biological detail. Motion sickness stems from sensory mismatch. The inner ear senses movement, the eyes may not confirm it. Smells and motion signals conflict. The brain flags mismatch as nausea. Vestibular dysfunction is common in older dogs and can be exacerbated by stress hormones. Addressing motion sickness might require anti-nausea medication from your vet or simple remedies like feeding less before travel. Don't assume just toughen up. Physical discomfort needs direct treatment. Learned associations require different tools, counter-conditioning and classical conditioning. Instead of forcing through fear, pair the car with low-level positive stimuli that gradually increase in value. A step-by-step example. Approach car, reward. Put leash on, reward. Open door, reward. Step into car, reward. Close door briefly, reward. Start engine for a few seconds, reward. Drive a short block, reward. Increase duration slowly. This predictable ladder rebuilds trust because the dog learns that the car predicts good, not pain. Control anxiety responds to training that emphasizes choice and routine. Teach a standby mat where the dog can retreat if overwhelmed. Use calm, consistent handling. Your own nervous energy leaks out. Dogs mirror it. Slow your movements. Use short, breathy praise rather than high-pitched excitement. Over time, your presence becomes a safety anchor. Watch for escalation loops. If you pull, tug, or cajole aggressively, you create reinforcement for refusal. Dogs learn that resistance yields escape. They will repeat it. Instead, use a neutral cue and reward the first tiny cooperative move. Celebrate micro-progress. The smallest voluntary step forward is the behavior you want to reinforce. Medical red flags. Sudden refusal in a previously car-happy dog can indicate pain, arthritis, sore hips, or a hidden injury that makes climbing difficult. Especially in older dogs, a vet check is essential. Also consider sensory deficits. Reduced vision or vestibular disease can make the car unpredictable and scary. Treat the body, then treat the behavior. There are also attachment dynamics at play. Some dogs associate the car with separation anxiety. The drive signals you leaving. In those cases, practice mock departures. Pick up keys, walk to car, return immediately with zero fanfare. Pair departures with healthy alone time training so the car itself stops being the primary trigger for your leaving. Before the emotional peak, consider practical aids. Use an open window for fresh air to reduce nausea. Secure a comfortable mat on the seat. Bring a favorite blanket with your scent, and keep the interior temperature steady. Calming pheromone sprays or a snug anxiety vest may help some dogs. When used alongside training, these tools accelerate progress, but they're supports, not fixes. Here's a critical loop many owners miss. Consistency matters more than intensity. A few gentle sessions every day beat one long, stressful attempt. Dogs learn by repetition, not drama. If you rush, you reset progress. If you're patient, you build a new expectation. The car is safe. Now the core insight. Your dog's refusal is information, not defiance. It's a request for predictability, safety, and control. When you honor that message with stepwise exposure, clear rewards, and medical care where needed, refusal transforms into willing participation. Finish with the emotional connection. Your dog is asking you to be the safe person who redesigns their world. They rely on you to rewrite the story of the car. Respond with patience, curiosity, and consistency. Your dog isn't just refusing the car. They're communicating a need. Listen, rebuild, and drive forward together.